we'd like to thank everyone who is listening to this video cast, and especially the AJR for publishing our recent viewpoint entitled The Translational Medicine of 2030, Bedside to Biosphere. And in this viewpoint, we take the concept of translational medicine, which historically has been bench to bedside. That is, looking at discoveries that are developed in a laboratory and bringing them to benefit patients. And we now extend this concept from the bedside to communities and then ultimately to the biosphere, which is really is a fancy way of saying all the parts of the planet that encompass living life. And Dr. Grist and I have proposed this framework because we think it's an opportunity for us in radiology to innovate and to continue the innovation that has been at the core of our history and culture. And I'm going to pass things on to Dr. Grist here, who can give a little more insight into what this means.
Well, thank you, Reed, and thanks for spearheading this effort. Your vision for the future of what we can do is truly remarkable in this space. And I think if we were to break this up into kind of two key themes, one would be that we really need to very actively do our thinking from the bench to bedside by developing low carbon emission protocols, reducing unindicated imaging. All imaging requires some production of carbon, and working with our industry colleagues to develop lower carbon footprint imaging techniques. Radiology has had a tremendous history of working together with our imaging partners in industry to develop and disseminate new techniques. And we really need to start doing that with a sense of the carbon footprint of our imaging devices, as well as looking carefully at contrast media and things like that. The other angle that we took, however, is that we really need to start thinking about this not only from bench to bedside, but from bedside to biosphere. And that we should start looking at developing technologies and assessing their effectiveness, not only for diagnosing and treating human health, but also their impact on the environment. So we created this little graphic here of the biosphere and Fryback and Thornberry's 6-level hierarchy of when we start thinking about new technologies and their impact on patient care, we need to look at their technical efficacy, their diagnostic accuracy, their diagnostic thinking, and all the way to societal efficacy. As we go through those steps, though, in developing technology, we really need to look at each step at the impact of those technologies on the biosphere. And that's a critical change in how we develop new imaging technologies and how we disseminate them. And we feel it's really important to put a timeline on this. And Reed, you established that timeline of 2030. How did you come up with that timeline?
Well, Tom, 2030, if we go back to the Paris Agreement from 2015, the Paris Agreement stated that we should try and reduce the temperature rise globally from 1.5 to 2 degrees centigrade between the pre-industrial levels and 2030. So the goal of the Paris Agreements was to try and corral all the nations in the world to having a tangible goal of reducing their emissions. And the same thing happened with the United Nations Sustainable Development Goals. Instead of having an abstract, hey, we're just going to go out and run, we think we want to train to run a specific race. And that's what we're trying to do here, run this climate race.
Very good.
Well, thank you to everyone who's listening, especially to the AJR editorial board for the opportunity to submit this viewpoint.